she went from 280 pounds to 180 pounds. And she actually had a couple of fluctuations of significant amount of weight loss. So you can see that she's got some excess skin here, and even some skin in the Mons area as well.
Behind the mask. The more you know, the better you look. Behind the mask.
What I was explaining to her, she wanted a tummy tuck, so we're going to be able to do a tummy tuck. We're going to make the incision down low, just right in that crease. It's going to be extended because we have to go a little bit further because she's got skin that keeps coming. And so we have to go where she has skin. And then we're going to do some liposuction as well. So we make a horizontal incision and we remove this extra skin. But she also has some excess skin in the horizontal direction. So she has excess in the vertical direction, but she also has some in the horizontal. So that's this way. And so to get rid of this skin that's in the middle, in this way, we also have to make a vertical scar. So not a lot of people want to have the vertical scar, and she's one of them. So what we're going to do today is we're going to make the horizontal scar, and we're going to remove all this skin. And I said to her, if this becomes a problem later, once you've healed from your tummy and everything's good, then we can go on and do what's called a completion fleur-de-lis. So if you start off and you make an incision here and you make an incision here, it allows you to remove this skin and remove this skin. That's called a Fleur-de-Lis Abdominoplasty. You don't have to do them together. And sometimes I'll have a patient that will come in and they'll have a lot of excess skin in this direction. And so we really say you really have to go and do the Fleur-de-Lis Abdominoplasty, meaning you have to have a vertical incision and a horizontal incision because it just wouldn't look very good. In her situation, she's kind of on the border as to whether she needs to have the Fleur-de-Lis operation or she can just have a regular extended tummy tuck. So sometimes, you know, if you're worried about a scar and we can do something as an intermediate step, or even potentially this may just be permanent, you never may get the vertical scar, but at least we're not burning any bridges and it allows her to see what it's like. So if she says, yeah, I've had the scar here, I had the tummy tuck, I get it, I do still have some excess skin in this direction, but it doesn't bother me and I'm fine and everything's good, I'm not going to have surgery, and then that's fine. But it gives her that opportunity to sort of reevaluate things later on. And so it's important when you're sort of considering some of these operations, what operations to do in what order, what to combine, and you sometimes it'll allow you to see how things look before you make another decision. Okay, so the next thing I did want to talk about is not only does she have excess skin in the abdomen, but she also has excess skin in the Mons area. And I can't show you much more of it than this, but you can see when we do the tummy tuck, I'm actually going to not make the incision right in this crease. I'm actually come down lower and excise or remove a little bit of her Mons area. You know, when you lose weight, obviously her Mons had excess fat before, so when you lose the weight there, it also shrinks. Just like this shrinks and you get excess skin, this shrinks and there's excess skin here. So what I explained is I'm going to go and I'll remove a little bit of the Mons. It's not a formal Monsplasty. A Monsplasty is when we're really focusing on the Mons area to rejuvenate this and make it younger, look younger. In her situation, when we're doing it at a tummy tuck, I don't like to be too aggressive with opening up this Mons area because it'll loosen that tissue, and then we need this tissue here to anchor. When we pull down the skin, we have to have this anchor it. And if you really free this up, the incision will really rise up. So she could potentially have an incision that was, you know, her scar would be more like up here. So we can't do a formal Monsplasty at the same time of a tummy tuck, so we don't want that incision to come up. So what I usually do is I cheat a little bit. I take some of the Mons to get an improvement, and then we'll wait 6 months or a year. And if that amount of Mons tissue that I took today wasn't sufficient to get the elevation of her Mons that she wanted, then we can come back, and it's fairly easy to do a Monsplasty, where what we do is we'll go through and we'll just reuse the tummy tuck incision, and we just remove more of the tissue that's there and then sew those two things together. That way, the tummy tuck incision is scarred down, and then we can take more of that Mons tissue because we're not worried about now the whole scar moving. The scar is kind of stationary in that position, and that way we can really address the Mons.